is Karen Gomes. I'm a registered nurse and work as a behavioral health care facilitator. I'd like to have a moment of your time to speak briefly on access to care for persons suffering from mental illness. According to the School of Public Health at Boston University, the U.S. sees more deaths by suicide than by traffic accidents, and more U.S. soldiers have died from suicide than from combat. Considering the consequence of mental illness, it's imperative that funding is increased to address mental health issues. Can you imagine not treating high blood pressure or diabetes? It is the same for mental health illnesses. If left untreated, can have dire consequences. The expansion of Medicaid to cover mental illness is a step in the right direction, but it does not provide patients with timely access to care. It is also difficult to find a Medicaid provider, and when one is available, there are usually lengthy waiting times to obtain an appointment. As a consequence, the patient usually ends up in crisis or an emergency room. Within the military health system, the medical home model has been instrumental in solving some of the access to care issues by incorporating a social worker or a psychologist into the primary care clinics. I ask that you advocate for increased funding to help develop mental health centers across the country. Advocate for increased government funding to employ more psychotherapists and psychiatric nurse practitioners. This would help improve access to care for mental health illnesses. Thank you for your time.